So my name's Marshall Watson. I'm a Noongar man. I'm a child and adolescent forensic psychiatrist, and I'm the incoming chair of the Aboriginal and Torres Strait Islander Mental Health Committee. Reconciling is about acknowledging what's happened before. It's about moving forward as well though. It's about growth. It's about how do we grow culturally as a college? How do we increase our competency, our fluency across multiple layers of the college? But also then how do we stand with and walk with and move forward with our Indigenous Australians? The Reconciliation Action Plan is around acknowledging the stories of Indigenous Australians, of how they come to be where they are, and what we've done and what we need to do more of to engage better with our Indigenous community. And in developing the Reconciliation Action Plan, it's acknowledging the ongoing work that we need to do to minimise the disparity between Indigenous Australians and non-Indigenous Australians. I think it's a really interesting time for the college because we now have an Aboriginal liaison officer. We have a good number of fellows and registrars and interested students through the Psychiatry Interest Forum, but also our work with AIDA. So there's a lot of other things that are going on that are going to help us to enable this RAP so that it becomes a working document, and how do we actually take that story forward from here for the college. This is a whole of college approach, and this is for people working within the college in the staff. This is about how do we engage with the board, how do we work with the board to enable the RAP, how do we then convey that to our membership, both fellows and registrars. And so there's a lot of storytelling and a lot of deep thinking and listening about how we actually enable our visions of the RAP. We reinforce the cultural safety that's within the college. The college is a safe place for Indigenous people to work. It's a safe place for them to train. But also it's about increasing our Indigenous workforce, increasing our number of registrars, helping those registrars get through that may be having some issues with training, and getting more medical students through. So training numbers is one thing, but it's increasing the cultural fluency. What could we be doing better within the college around cultural fluency, cultural safety, cultural competency, but also then working with the board and also our various committees as to how do we then enable them to consider the needs of First Nations people and trainees. Also how we're working particularly with Indigenous organisations such as ACCHOs or other Indigenous organisations as well, but also how do we work with other colleges as well that also have RAPs.